India is now one of the fastest growing economies of the world. But as this nation of over 1 billion people moves from an economically impoverished one to becoming a favorite destination for global business, it faces a threat with the potential to undo its economic progress: HIV/AIDS. UNAIDS estimates that 5.7 million Indians are infected with HIV, a majority of them between the ages of 15 to 49. Ashok Alexander, director of Avahan India AIDS Initiative, believes that India is on the brink of a national HIV/AIDS epidemic.
India's prevalence is close to what South Africa's was in the early 90s, close to what Thailand's was, which was at about 1%. We are close to that marker. So we have to prevent an upward spiral in HIV/AIDS. It's a very significant number to look at.
The challenge to curb the virus is compounded by low awareness levels, a poorly equipped public health infrastructure, and widespread stigma that makes it difficult for people to participate in prevention programs or come forward for treatment. To combat HIV/AIDS, the American India Foundation has initiated programs focused on preventing mother-to-child transmission, educating vulnerable populations about prevention, and expanding access to health services. To help save more lives, AIF is working to scale up these programs in collaboration with a range of partners. Through Nukkad Nataks, or street plays, AIF partner Grameen Development Services is raising awareness about HIV and its symptoms. Durgavati approached GDS after seeing one such play.
When the Nukkad Natak came to our village, I went to see it. There I spoke with Kiran of GDS. After talking to her, I felt I had to get myself examined.
Durgavati has tested HIV positive. She contracted the virus from her husband, who worked as a carpenter in Mumbai. He died, leaving Durgavati with 4 children. She now works as a daily wage laborer, barely able to make ends meet. With guidance received through the intervention of GDS, Durgavati has a good chance of living a normal life. Durgavati was lucky. She found help and treatment. Sadly, only 10% of those who need them are able to receive antiretroviral drugs. For the majority of those infected, the journey to the city and the red tape in the hospitals and access to medicines is too expensive and cumbersome a process, even though it's a question of life and death. Avahan, a national HIV/AIDS prevention initiative of the Bill and Melinda Gates Foundation, works closely with high-risk groups to create awareness about HIV. Here, some 2,000 truckers have gathered to watch an entertainment program with Bollywood and Hollywood stars. The message given is loud and clear.
Thank you very much. We have a strategy that focuses on the groups most vulnerable to HIV. So we work with about 300,000 commercial sex workers and injecting drug users. These are the most vulnerable groups. Again, we focus it geographically. We take this effort to 6 states, within those 6 states to 70 very critical districts.
Another initiative by Avahan in Maharashtra is Mukta, or Freedom. It trains sex workers like this group in Pune to serve as peer educators to teach community members about the transmission and dangers associated with sexually transmitted diseases and HIV/AIDS.
Since the project started, we have come to know what HIV/AIDS is and how deceptive and dangerous it is.
As HIV/AIDS spreads in India, millions of men, women, and children are affected by it. Thousands of children have been orphaned, many carrying the virus as a result of parent-to-child transmission.
People who live in the U.S. have their origin somewhere in India. Many of those districts or the hometowns that they came from, they would be surprised to find today are battlegrounds for HIV/AIDS. So can they think of adopting certain districts? Can they think of bringing their resources to bear for HIV prevention or for public health in the places that they came from.
With rising awareness comes the responsibility to care for those afflicted and prevent others from falling prey to the virus. There is no other option. HIV/AIDS must be defeated to protect India's future. So join us today. With your support, we can make a difference in people's lives.